Today I'm here to teach you to use an MDI or a meter dose inhaler properly. In order to manage your asthma well, you need to know how to take your medication properly. Now, nebulizer, they're not very portable, but they don't require a whole lot of skill to use correctly. An MDI, on the other hand, is very portable, meaning you can always have it with you and carry it with you. And if you ever find yourself in the midst of an attack, you're always going to have your MDI to help pull you through that much more quicker. But MDIs need a little bit of skill to use. You need to be taught how to use it properly. MDIs are just as effective as nebulizers if you know how to use it properly and you use a spacer device. A spacer device looks like that. What a spacer does, it just basically captures the medication and lets a flow of air carry the medication down into your lungs to where it actually gets there and can actually open your airways up. Because if you don't use a spacer, if you just put it in your mouth and puff, 80% of that medication is actually going to bombard the back of the throat, stay in your mouth, get absorbed into the bloodstream, where it's going to go to the heart and increase the heart rate, make you feel a little bit jittery. In children, it's going to make them hyperactive. Whereas if you use a spacer, 80% of the medication actually makes it down into the lungs. The more medication that makes it down into the lungs, the more effective the breathing treatment's going to be. The more effective the treatment, the quicker the recovery time. Now, you parents that have asthmatic children, sending them out during the day worrying that they're going to be in the midst of an attack, if they're going to have anybody around to help them, there's always in the back of your head. Now, this tool, an MDI with a spacer, and the proper knowledge and how to use it will provide a little bit more peace of mind for you when you send your children out. Now, to instruct or to use an inhaler properly, there's about 9 or 10 things that you got to really know. They're pretty easy, but they're very effective. One thing you got to do in preparation for your inhaler is start using pursed lip breathing before the treatment. A couple minutes before the treatment when you're preparing to take it. Just breathe through your nose and out through pursed lips. Blowing through pursed lips will actually cause a back pressure to go down into your constricted, swollen airways and help splint them open to where you can exhale all that stale, trapped air out. That way you can take deeper breaths and breathe a little bit more effectively and get more medication down into the lungs. So as you're getting ready to take your treatment, do pursed lip breathing. Get your canister and shake it for about 10 seconds, 10 to 15 seconds. That's going to mix the propellant and the medication. If you don't mix it up, those puffs are only going to pretty much consist of the propellant, and treatment's not going to be that effective. Whereas if you mix it up, it's going to have a good mixture of medication. You're going to get as much medication as you can. So as you're doing your pursed lip breathing, shaking it up, getting ready to do it, blow out. Blow out all the way. The more you blow out, the deeper breath you can take when you actually take your inhaler. So blow down. Don't ever squeeze or push it out. Just exhale to where you don't think you can have any more air in your lungs comfortably. Put it in your mouth and squeeze and puff. Squirt. And then hold. Wait a second or two between that puff and then that inhalation. That'll allow you actually to get a little bit more medication down into your lungs. Puff. Squirt. Slow, deep breath in with the breath hold. If you breathe in too fast with the spacer, it'll cause a whistle. That means you're blowing in too fast, and that medication is going to impact the back of your throat. Again, not allowing a lot of it to make it down. A nice, slow, steady, deep breath in will get more medication down to the lungs. And it's important once you take that deep breath all the way in, to hold it for as long as you comfortably can. That'll allow the medication to attach itself to the lining of your airways to where it needs to expand and dilate those airways open. If you just puff it and blow right back out, you're going to exhale most of the medication back out into the atmosphere. It's not going to be as effective. So, shake it up, pursed lip breathing, put it in your mouth, squirt it, wait a second, and then low, deep breath in, hold for as long as you comfortably can, and then exhale. That's your first puff. Now between your first and second or any subsequent puffs, use your pursed lip breathing, shake your medication, and wait at least 2 minutes between puffs. If you immediately put it right back in, that first dose isn't going to be able to act as and open your airways open, so the second dose can get even deeper in. So if you wait a couple minutes, that first dose will actually allow the second dose to get that much more deeper into the lungs, making your treatment that much more better and more effective. So pretend it's 2 minutes. It's time to do it again. Puff, squirt, deep breath in, hold, then exhale. And then however many puffs your doctor prescribes you to take during an asthma attack is what you do. Always a couple minutes in between. Shake it up before each puff. Always hold that air into your lungs. Allow that medication to attach itself to the lining of the airways. Pursed lip breathing before and during and between your puffs. That'll make a more effective breathing treatment, less side effects, and you should have to use less of the medication as well.